Green Health Wales have compiled a small selection of different projects happening throughout Wales currently. We welcome more clips of projects and efforts across Wales to highlight on our website www.greenhealthwales.co.uk. Learn, connect, transform healthcare in Wales.
I'm Tamsin Cowden. I'm a community staff nurse in Powys Teaching Health Board, and NHS Green Bees is a Bevan exemplar project. It aims to cut waste, cut carbon, save money and save bees. I worked with 6 teams, and each team member was asked to choose from one of these 9 sustainable actions. These included using TerraCycle to recycle crisp packets, putting a big expiry date on stock boxes to help avoid waste, and sending any out-of-date stock to Hillditch. All the other actions can be seen on my action pack on the Green Health Wales website. If everyone continues with their actions for a year, we'll have saved hundreds of plastic bottles, we'll have cut waste, cut 260 kilos of carbon, saved £700 and created 4 bee-friendly areas. The main obstacle to greater achievements was very few people accessed my action pack or supporting video, probably due to lack of time or them just not considering the project a priority. So phase 2 is different. We've created an NHS Green Bees staff group full of motivated individuals. We're working closely with our sustainability team on projects such as getting recycled paper as a default throughout the trust, and we've also organised carbon literacy training with the support of our chief executive, and we're really hoping that all our executives will attend.
Hi, I'm Jem. I'm a 4th year medical student at Cardiff University. This past year I've been working alongside a few other students to complete the Planetary Health Report Card. The Report Card is an initiative that was set up by an American medical school last year and has this year spread more widely to include the UK and Ireland. The aim of the report card is to evaluate how well medical schools are addressing issues relating to planetary health. Sections included in the report are planetary health in the curriculum, interdisciplinary research in health and environment, community outreach and advocacy, support for student-led planetary health initiatives and campus sustainability. The report card highlighted that there is significant improvement needed to meet the current demands and needs of the global population. Going forwards, we will use the baseline results of the report to both encourage change and monitor progression of the changes we hope to make. The collaboration between medical schools has provided us with information on the ways in which other medical schools have tackled these issues, and we'll be able to imitate these to improve our own efforts towards a greener health in Cardiff.
Midwives and other NHS staff here in West Wales are delighted to support the launch of the Queen's Green Canopy.
NHS Wales is really delighted to be involved in the Queen's Green Canopy.
This special campaign encourages people across the country to plant a tree for the Jubilee between October and March. This is going to enhance our environment now and for future generations.
This year we'll be planting trees all over our estate to celebrate the Queen's Platinum Jubilee.
Working with Pembrokeshire Nature Partnership on a local project here near Wolf's Castle, we have already planted 3,810 trees. These represent babies born to families in the county in 2020 and 2021. The partnership plans to continue planting trees annually to create a thriving woodland where families can connect with nature and enjoy nature together.
And we would encourage you to join us at Cardiff and Vale Health Board to plant a tree for the Jubilee.
We encourage everyone to develop local projects of their own and plant a tree for the Jubilee.
Cardiff and Vale University Health Board is one of the largest NHS organisations in the UK and has always recognised the need to take action to reduce its energy use and environmental impact. The estate is made up of 2 acute hospitals, 4 smaller community hospitals, and over 40 healthcare clinics, premises, offices and residential properties. The Health Board are working in partnership with Vital Energy through the REFIT programme to deliver significant energy, carbon and cost reductions and to help support and deliver the Welsh Government's decarbonisation strategy and targets. The first phase of the project, which commenced in March 2020, was to deliver a selection of non-complex energy conservation measures. These included replacing 7,000 lights with LED bulbs and installing smart controls, over 100 replacement fans, belts and motors to more efficient alternatives, as well as pipework insulation. The annual carbon emission reduction is estimated at 700 tonnes, saving £300,000 to £350,000 per year. Furthermore, the measures have also improved environmental comfort conditions in a range of areas and the infrastructure of the estate. The second phase of work covers more complex energy conservation measures, including building management systems upgrades and optimisation, a further significant LED lighting replacement, a complete refurbishment of the Landau Hospital Energy Centre, and a major roof-mounted solar PV scheme.
Hi, I'm Kirthi.
Hi, I'm Victoria.
And we're both final year medical students at King's College London, currently on our elective placement with the Centre for Sustainable Healthcare.
As part of our placement with CSH, we've been helping the Green Health Wales team organise this launch event. We started about 2 months ago, so I've been able to witness and help out with lots of different stages of planning.
Our work for Green Health Wales has mainly been focused around communications and marketing. We've been sending out lots of invites, making sure any queries from ticket holders are resolved, as well as spreading the word about the launch event on our socials.
This might not be the typical project you'd expect to hear about. However, through our work, we hope that we've helped the Green Health Wales team with its first steps to becoming an initiative central to sustainable healthcare within Wales.
All different kinds of collaborative work are essential for sustainable healthcare to thrive. We've really enjoyed helping to launch Green Health Wales and wish it every success for the future.
My name is Tim Morgan and I'm an optometrist contractor in North East Wales. At the moment I'm enjoying a seconded year as a clinical fellow with Health Education Improvement Wales, reporting to Welsh Government. My task is to assist in exploring the various options available in contract and service reform and also to ensure that optometry delivers prevention and wellbeing. Now, initially I began thinking of prevention as something that is delivered between a clinician and patient. However, I now realise it is much more than just that. It's also about prevention and well-being for future generations. I propose that we need something that is a toolkit or a framework which facilitates good behaviour. So I totally believe that clinicians in optometry and all primary care contractor professions want to act in the best socially and globally responsible way, but we need to be encouraged, supported and celebrated properly to achieve this in a standardised way across Wales for that to carry the most impact and power. I think patients need to demand more from their service, performers need to demand more from their contractors, and contractors need to demand more from the health boards and national bodies, just as we all need to demand more from ourselves. So I'm really looking forward with excitement to a time when this sort of excellent social and global responsibility and behaviour is not just facilitated, but it's expected. That's what I'm pushing for as a clinical fellow and as a contractor and performer, and I look forward to joining you all in that future very soon.
Healthy Travel Wales is being led by Dr Tom Porter from the Cardiff and Vale Local Public Health Team, working with the 2 public service boards and other public bodies. Car use has sharply increased throughout the last 50 years, and in turn, walking, cycling and the use of public transport have declined. Our reliance on cars for regular transport has contributed to multiple impacts upon our health and well-being, such as sedentary lifestyles, social isolation, and the climate emergency. However, there are many actions that can be taken to create change. This table demonstrates the wide array of potential benefits from such changes. These include reduced physical and mental health illnesses, to wider benefits such as reduced health inequalities and carbon emissions. There are a number of programmes to help us transition in how we travel. For example, legislation in Wales such as the Wellbeing for Future Generations Act, national and local policy like Planning Policy Wales, and planned improvements to transport infrastructure such as the Transport for Wales franchise. Another way organisations across Wales have been showing their commitment to healthier and more sustainable forms of transport is by publicly signing a Healthy Travel Charter. Each charter contains a series of commitments that public sector organisations and businesses will make over the next 3 years to encourage their staff and visitors to walk and cycle more, opting for public transport and switching to electric vehicles. The existing charters include Cardiff, the Vale of Glamorgan and Gwent, with 50 organisations in Wales having signed a charter. If you work in an organisation covered by the existing charters, then you can discover what your employer is currently offering to help you make the switch. If your employer is not yet a signatory to their charter, then you can suggest they sign up.
Hi, I'm Ben. I'm the campaign and programme lead for climate and health at Medac. Medac is a public health campaigning organisation that works so that everyone can exercise and achieve their human right to health. And we work across 4 main campaign areas: access to healthcare, peace and security, economic justice, and climate and health. We're building a grassroots-powered health movement for a just and green society through the Health for a Green New Deal campaign. The Green New Deal is a 10-year action plan to rapidly cut emissions, to create millions of secure and well-paid jobs, to transform our economy to serve the needs of people and planet, to protect and restore the environment, and to promote global justice. It's an agenda for the whole of government to tackle the root causes of climate breakdown and health injustices. Health for a Green New Deal aims to build mass support in the health community for a transformative Green New Deal, and to support those working in health to organise for a just transition to a zero carbon society. We're building health action on a local and national level to oppose big polluters, to support the creation of millions of good green jobs, and to stand in solidarity with communities around the world already suffering the worst impacts of the climate crisis. We welcome all of those working in health or studying in health to join us. To get involved, go to health4gnd.uk or email me at benida@medac.org. Thanks.
Well, let's get more from the charity behind it. Robert Penn, co-founder of Stump Up for Trees. Welcome, thank you very much for joining us. It's an interesting look at actually the impact of another impact of COVID that we haven't thought much about, haven't heard many people talking about. What made you focus on that?
Well, I mean, we were surprised and rather humbled and delighted when Dr. Jack Parry-Jones came to us and said that he'd like to plant some trees to commemorate all the patients that have been through the University Hospital ICU unit over the pandemic. And like you say,
Stump Up for Trees is a community-based charity focused on creating woodland in the Brecon Beacons area of South East Wales. The charity is planting 1 million trees, which will enhance biodiversity and provide natural flood management.
We'll measure the carbon at 5 years. So there's a verification process which takes place when the trees are 5 years old. And we'll do that, and then you can accredit that as a carbon offset. But it's saying that bit of it's complicated, but less complicated and more exciting is the change that the planting of trees brings about to the landscape, and that includes reducing air pollution, improved soil quality, at some point in the tree's life, sustainable timber, medicine conceivably, and importantly, habitat for wildlife. And that's really one of the main drivers behind our charities. And we're obviously in the game of mitigating climate change by sequestering carbon, but we're also in the game of trying to arrest the biodiversity crisis by improving habitat for wildlife.
Thank you very much, Robert Penn.
We received an update after a recent inspection of the beekeepers at University Hospital Landau, Cardiff and Vale University Health Board. The bees appear to be happy and healthy, and they are thrilled that both hives are doing so well, some of the best they have seen. The team are hopeful that the honey will be fruitful this year.
I'm Suzanne Tarrant, Consultant Clinical Psychologist and Head of the Staff Psychological Wellbeing Service for Hywel Dda. Our Green Health Network was established in October 2018, and our first Green Health Group was set up at Withybush Hospital in January 2019. We now have one at each of our 4 main district general hospitals and 2 at community hospital sites. Our Green Health Group leads come together on a regular basis for support and sharing, and we've developed a resource pack and guiding principles to help staff develop their green health ideas and enable sustainable and successful green health projects. The work and interest are really gaining momentum now, and we've had a few small but successful projects so far, working in partnership with colleagues, community groups and other organisations. These include working with NHS Forest to plant 200 trees, creating mini meadows with the help of Plant Life Cymru, installing some starter nature gardens with the help of Keep Wales Tidy, putting up Swift boxes with the assistance of Pembrokeshire County Council, and the wonderful Actions for Sustainable Parenting and Pembrokeshire Tree Planting project led by one of our midwives, Becky Johnson. We are really looking forward to connecting with and learning from colleagues across Wales to continue our partnership working, creating healthcare environments that are truly health-giving.
The following footage is a snippet of Cardiff Dermatology's talk in RSM's Health Emergency of Climate Change series, given on the 13th of April 2021, titled Environmentally Sustainable Dermatology, a Topical Issue.
It would be difficult not to notice the explosion of plant-based, eco-friendly and natural skincare products that have come on the market in the last 10 years. But unfortunately, the terminology is marred with ambiguity. Similar to the term organic, there is no regulation defining the term natural. And it is interesting to note that the Soil Association found that 80% of people said that they would be more likely to buy a product if it was labelled as organic. This highlights the enormous marketing potential that these terms offer, and coupled with a lack of associated regulations, make for worrying trends in the industry. Some could argue that the skincare and cosmetic industry is outside the remit of medical dermatologists, but I would say that unless we as a group of professionals with expertise in skin look to change this narrative, the likelihood is that nobody else will. And I don't know about your own experience, but I have lost count of the number of patients who have told me that they like to use natural products, and I find it really beneficial to be able to advise them on what these terms actually mean. In my current role working in the patch test clinic, I often come across patients who develop allergy. And one of the natural products that we test for is linalool. So it certainly is natural as it comes from flowers and plant spices. But these UK studies demonstrate that there was almost a 6% allergic contact dermatitis detected in this multi-centre UK study. This is one of the examples I like to use when explaining to patients that natural and plant-based doesn't equate to skin safe. Of course, we also need to remember that natural does not always mean sustainable. Rare ingredients and energy-intensive processes may be a lot less sustainable when compared with synthetically created materials. So lab-based does not have to equate to damaging. So take-home message 3 is just the importance of reading the fine print of the label and not to be distracted by the slogan marketing.
Hi, my name's Amarantha. As part of my Clinical Leadership Fellowship in Sustainable Healthcare 2020 to 21, I have been investigating the seemingly innocuous medicine nitrous oxide. I'm talking about the 2 different forms of medical nitrous oxide we give to patients, pure nitrous oxide and Entonox at the 50-50 ratio of nitrous oxide to oxygen. Nitrous oxide is part of the furniture. It's been used for so long in healthcare that right now, I challenge anyone watching to recall the number of wall outlets present in your clinical environment. As soon as you start counting, you notice them everywhere. Multiple nitrous oxide outlets in resuscitation bays, Entonox outlets for every cubicle in minor injuries departments, and an inhalation sedation unit in every dental bay on a clinic. The problem is nitrous oxide is a potent greenhouse gas specifically named in the Paris Agreement. It's a polluting gas 300 times worse than carbon dioxide, it's a pharmaceutical drug, and a controlled substance hazardous to health. But when was the last time you documented a full prescription? Nitrous oxide is exhaled without being metabolized. The fact that its molecular structure remains unchanged, like other anesthetic gases, means that every molecule we purchase counts towards our Scope 1 emissions directly produced by hospitals, for which health boards are responsible. If we quantify nitrous oxide products by purchases alone, the carbon tonnage is staggering. For Cardiff and Vale alone, including an extra 5,668 tonnes of carbon increases our reported 1920 Scope 1 emissions by 20%. A significant portion of the products we purchase are unaccounted for. Do you know how much your patients need and how much they're using? To find out more about the investigative process, please have a look at our introductory video linked on the Green Health Wales website.
The following footage is a BBC Wales report on a letter sent on behalf of hundreds of healthcare workers to the Welsh Government in July 2020. Speaking is Dr Farzad Sadat, a Welsh Environmental Anaesthesia Network member, one of the many organisations that has signed the letter, along with Ysbyty Gwynedd Green Group, working with hospitals across Wales to cut back on harmful gas emissions. Tracy Ross speaks about her experience with COPD and how she's noticed a difference with lockdown's better air quality.
The environment, air pollution, climate change, these are going to be the biggest, and I include COVID-19 in that, but they are going to be the biggest healthcare issues of our lifetime, and certainly of the 21st century. We represent healthcare professionals and student healthcare professionals across Wales, and we've come together to write this letter to the Welsh Government to ask that when it comes to rebuilding after COVID, that they put the environment and sustainability at the centre of any policy formation. You don't need a scientific degree to see that the environment that we live in, the air that we breathe, the water that we drink has an impact on our health. So, as health professionals, we strongly urge the government to look at these things, to increase sustainability, to reduce our impact on the environment, and to secure a healthier future for all of us in this country. So over the last sort of 18 months, 2 years, we have coordinated with anaesthetic departments around Wales and reduced the greenhouse gas emissions from our practice. We've managed to reduce that by about 130,000 kilograms of CO2 per month, which is the same as flying to New York 130 times.
The air quality before used to make my chest feel really tight and restricted. I was back and forth to the doctors just to make sure that's what it was. Since lockdown, it's been fantastic. I've been ill, but I haven't had that level of restrictedness in my chest. When I'm doing some walking, I feel like I'm breathing through straws. There's probably a lot of people unaware they've got lung conditions or have got other conditions who haven't yet realised how much staying in deconditions your body. By having poor air quality now, there's going to be a lot more people suffering.
This was a small selection of everything happening in Wales. If you'd like to join our team or send us videos of your work, contact us on Twitter @GreenHWales or email us on info@greenhealthwales.co.uk.